Welcome back to Inner Peace and Power. We have an incredible guest with us today. Our guest today is my friend, Dr. Jeannie Lawrence. So, Dr. Jeannie Lawrence is a board certified psychiatrist and a physician coach. She is the founder of Sanctuary Institute for Life Mastery, where she helps women physicians recover from burnout so they can live with more intention, calm, and power. Welcome to the podcast, Dr. Jeannie Lawrence.
Thank you, Dr. Rashmi. I'm so excited to be here. I appreciate the opportunity.
It's a long time coming because you
That's
and
what
I have known
I'm
each other
saying.
for years.
I
And
know.
before we hit the record button, we're like, how has this taken so long? But anyway, it's here and I'm so excited for it. So, Jeannie, would you share your story with us?
Yes. I guess I'll start with medicine and why I went into medicine, like most doctors, to help people. I'm not somebody who knew forever that I was going to be a doctor. Is that kind of a last minute decision in college because I'm kind of multi-passionate. I thought I might be an English major, which I love just as much as science. But I had an experience in college where I was able to volunteer at a free medical clinic, and that kind of sealed the deal for me because I fell in love with the clinic environment, but also this idea that I could meet people where they were and offer them hope and healing. And so that's what I decided to do. I decided to go into medicine, went into psychiatry. And I like to say I didn't choose psychiatry, it chose me. I did not know that psychiatry was a thing, really. I'm the only doctor in my family, first doctor in my family. I thought that I would probably go into something like primary care. But after my rotations, psychiatry for me was just hand in glove. Like all the others were fine, they were good, but like when I got to that rotation, I was like, okay, I was meant for this. I was very comfortable, like being around patients and loved their stories and holding space for them. And yeah, I loved the psychopharmacology and this idea again that I could be a part of transformation and change in a person's life. I remember when I was a resident and a little bit naive and a med student also a little bit naive, it looked like there was a lot of dramatic change that we could do in a short period of time. If you've ever seen someone come in crisis, like on a psychiatric unit, suicidal or psychotic or something like that, within a couple of days or weeks, their mental health is restored, or it appears that way, right? Where they're organized and they're making plans for the future. And I wanted to be a part of that kind of change and transformation in people's lives. That's how I got into psychiatry, just a love for people, stories, and the science that comes with that. I feel like post residency, like within a couple of months of residency, was the culmination of everything I'd been working for in my young life to that point. Not only had I earned my doctorate and finished my residency program, but I got engaged my last year, I think, of residency. And so we got married a couple months after graduation, moved from my one bedroom apartment to this big nice house, and moved from the city that I was training into a new city. And so there was a lot of change at the same time and a lot of things that I wanted to happen like all at the same time. And bring that up because it was a very happy time. And I think a lot of times, at least I felt this way, and I know most high achieving women think this way. It's like you set these goals and you work really hard towards them, and you do it because you think you're going for the goal, but it's because you think you're going to be happy, right? We're doing these things because we think that they're going to create like this end of the rainbow, happily ever after kind of experience. And while that was a really happy time and all of that, it wasn't forever happy. It wasn't happily ever after. And I think a question that I had never asked myself, and I don't think a lot of people ask themselves, is like, what happens like after, right? You've achieved all the things and created the success. Like, now what? And that's where that was a question I didn't have answered. And really, I had to confront that after some time in this new life as a new attending, as a new wife, as a new homeowner, like all of these things, right? Some of the magic kind of wore off, right? And I'm faced with the reality of living in a new city, not having family and friends close by, being the only doctor at my site, taking care of really sick patients. And I had become used to being like, as again, like the doctor and the doctor in the family and the person that seems to be doing well in the friend group and all of that as the person who has the answers. And for the first time in a long time, like I didn't have the answers, right? And I put a lot of pressure on myself to keep that to myself, I think. And I think a lot of the women that I work with, at least, put that same pressure on themselves, right? And some of that comes externally, but it's internal as well. I found myself in this beautiful life on the outside feeling lonely, disconnected, not super fulfilled in my work after a while, feeling like what I was doing wasn't exactly the vision that I had when it came to helping patients in the way that I thought I should. All of these things I was grappling with, and I was doing it on my own because I find that a lot of people don't understand what I would have to complain about, right? And so I kept quiet, and that became a lonelier and lonelier place, and really sparked, like, it became clear that I had to do something to start to make some changes. So I'm going to pause and let you ask any questions that you want right there, just because I've been talking for a while. But yeah, that's the beginning of my story and how I started moving towards something different. Yeah.
Yeah. You're describing a very courageous thing is self-awareness of you understanding that like I described my similar experience because I was tracking all the way through there. It was a very glossy looking life from the outside, and I felt like a dumpster fire inside. It just didn't, I was just running from one thing to the other without really having a real true compass. And then I think there's always that arrival fallacy that you talk about. We can have it the rest of our lives. Fill in the blanks. As soon as I get married, I'll be happy. As soon as I get divorced, I'll be happy. As soon as I get this new job, I'll be happy. As soon as I leave this job, I'll be happy. That's part of the human condition. It's just part and parcel of the human condition. And so that you had to have that lived experience of achieving the thing
Yeah.
and being like, oh, and I often talk about those really five important words in every person's life is this all there is? And the minute we get to ask that question, I think that's when really everything else gets to open up. And so we get to explore what that means without necessarily feeling like you're not grateful for the things that you've achieved or the things that you have. I think because in our minds sometimes, and I think probably everybody listening can also relate to that because we can do comparative suffering, like you were talking about. You had real suffering, but then there was that protector part of you that was like, yeah, but it's not as bad as this other person. So what do I have to complain about? Whereas the truth is suffering. And so you clearly started to understand that and started to move towards that softness and that grace for yourself, that's you doing all this work right now. And I feel like if we haven't done the work on ourselves, and that is actually a forever thing. It's not like it's one and done. Then it becomes really apparent, right? Nobody else is going to come work with us. So clearly you did things very differently based on kind of that space that you just described.
Yeah. Yeah, I did. And it wasn't like that, right? It wasn't a snap of the fingers, right? It was a journey, it was a process. I think a bit of a turning point for me was what I was doing is like what most people do, which is I'm not feeling great. Let me try to fix this. This is what physicians are fixers. So let me think really hard about like what's the problem, and let me come up with a plan, and let me push harder, and let me find like what external circumstance in my life I need to change and adjust so that I can get back to being happy. And so I spent a long time doing that. One day I was taking a walk, and it's a bit of a light bulb moment for me. I was taking a walk and I was listening to a podcast I hadn't listened to before, and it was a coaching podcast. And I didn't know what coaching was at the time, but I tuned into this podcast, and the host said something that I'd heard a million times before, but it landed totally differently for me. She was talking about how our own thoughts create our emotions and our reality. And it landed with me because like I'm a CBT trained like psychiatrist. So I did like extensive training like in cognitive behavioral therapy in psychiatry residency. And so I knew that concept. It was something that I applied to my patients all the time. And I taught my patients all the time. But there was something about hearing it like outside of the clinic, outside of the exam room on a podcast, which is a totally non-clinical space in most cases, that made it something that landed for me like this might apply to me like in my personal life, like not someone who sees herself necessarily as a patient or sick or anything like that in this moment, but who is, as you said, like suffering is suffering, who is like dealing with these emotions and these realities that aren't aligning with my expectations. And like, what if the answer isn't in changing my whole life because that wasn't working for me? What if there's something that I could do internally and within? And that gave me a lot of hope. Yeah, it stopped the cycle that I was in of trying to find answers outside of myself, essentially, and start to pay attention in the first place to what was going on internally. You talked before about how the dumpster fire inside and running through life at lightning speed, checking the boxes, but without a compass. I think I was in a similar similar space of running through life and not paying any attention to what was really going on with me internally, how I thought, how I felt, these things that I'm always asking other people, but never slowing down or thinking to ask myself. And when I started doing that, it gave me a locus of control. It gave me something to start to be able to work with in my life that was internal as opposed to external. And it really changed the game for me. I started applying these concepts to my life and noticed that for the first time in a long time, I felt better. And it wasn't because things had really changed externally to me, right? It wasn't because I hit this goal or this milestone or done something incredible at this phase in my life. It was just because I was starting to think about what I was thinking about and feel how I wanted to feel on purpose, which was very empowering for me. 2020 rolls around and COVID hit, and everybody knows and remembers that. And that was a really scary and dark time for everybody. And it was uniquely scary and dark for physicians being on the front line of the pandemic and just all of the how horrible it was, right? To not know what was going on, right? This new virus that we've never experienced before, and we don't have vaccines yet, and we don't have appropriate PPE, and we don't know how long it's going to last. Very scary, dark times. And I found myself as a psychiatrist, I was seeing patients, but not on the front lines in that same way, like not working like necessarily in an emergency room, but having a desire to help contribute in some way beyond, my patient load immediately in front of me. And so everybody's spending lots of time online because we had to, because we were isolated from each other. And I'm starting to, be on Facebook a lot more. And I'm like in these physician Facebook groups and I'm hearing the stories of our colleagues and how, like I said, how terrible it is. And like the stress and the distress that people are facing. I thought, I have something to say about this. Like, if nothing else, like I know how to maintain one's a level of like mental stability and emotional stability, even in the midst of difficult circumstances. It was, part of my training, but also like what I had done for myself. Like I said, my circumstances hadn't changed in my own life either, but I had found a lot more peace and happiness. And so I started blogging first as kind of a creative outlet and also just as a way to try to share some hope with people in my circle. At first, I was just sharing with my family and friends, but eventually in physician groups. And it caught on when I started talking about the unique struggle, I think, of like the high achieving woman and the unique struggle of the woman physician who appears to have it all together right on the outside and appears to have created this incredible success that lots of people are after and trying to create. Inside feels like a dumpster fire, or inside is like, kind of riddled with anxiety, distress, burnout, depression, like all of these things. And doesn't really know like who she can talk to about it, doesn't really know, like doesn't have a safe space to work through some of these challenges. And that landed for a lot of people, especially women physicians, I realized. And anyway, I decided that I wanted to be a part of the solution in my own community of colleagues. And so that's how I moved intentionally into this space. A lot of people ask me like, okay, well, you're a psychiatrist, like why go this route? Like why open a coaching practice? I like to say it was very intentional. I think that what physicians need and what women physicians need, and we don't always have access to, is easy access to things that will help us with the inner struggle that we have. We know there's lots of stigma, unfortunately, still around mental health and all of that. There are still barriers that physicians face to getting mental health treatment, right? There's still very real concerns that people have about what's the board going to ask me and what's going to happen to my ability to work and make money for my family if I do this. I'm not saying that the work that I do is a substitute in any way for mental health treatment, but I think a big part of the conversation has to be, how can we encourage help seeking in all of its forms? How can we get away from what I was doing, which was internalizing everything, right, to starting to have safe spaces where we can work through these things and process and start to move forward.
That makes a lot of sense. And I agree. I am in Florida and I haven't looked at the regulatory stuff, but I believe it still needs to go to the board if there's any kind of psychiatric intervention. It's a real shame because we lose physicians to suicide very, very often because there's just that huge stigma to getting mental health care. And so, yeah, I mean, I think you and I agree, like, coaching isn't a substitute for mental health care, but it can be a great entry point for people to start to have a safe space, which oftentimes is the most therapeutic thing that can happen in when somebody is in a chaotic internal space. So you talk a good bit about burnout. I wonder if you would share with us one of the things that sometimes we think of burnout is it's a one and done process. And a lot of times we think that if I take 2 weeks off, I'm done. Like, what do you find? And can you help us get a 10,000 foot view of burnout, most specifically in high achieving women, and what you see as you've been doing this work?
Yeah. I think that's a good question because burnout isn't yet a clinical diagnosis like in the DSM in the same way that like major depression is and things like that. There can be like a little bit of a sense that it is something that can be fixed right with a 2 week vacation, right? But really burnout is a chronic smoldering stress state, right? That forces like your brain and body to go into survival mode until you can't even do that any longer, and then things start to just shut down, and it's a slippery slope right into like the more clinical stuff like major depressive disorders and things like that. We know like what the kind of textbook symptoms are, right? Like the emotional exhaustion, the cynicism, the depersonalization, but what that really looks like in practice and like what I see is a loss of meaning and purpose in work that most people really it sounds like a small thing, but it's a big deal because physicians like myself like and like you like went into medicine because we really wanted to help people and sacrificed an awful lot to do something that we're very passionate about and to start to wake up daily and dread like going to work and dread living this life that you worked really hard to create is a really tough pill to swallow. There's this loss of connection with not only the work but like the patients and the people, right? It's like where you start to see patients like as numbers and all you see is like the never ending checklist of things that we have to do our jobs as opposed to like purposeful work that's all about like connecting with other human beings and bringing hope and healing, which is probably what you started out doing in the first place. The emotional exhaustion, right? It's like that. I mean, it's by definition like the kind of exhaustion that doesn't go away with a good night's sleep or a nap or a couple weeks off or anything like that, but that is pervasive and like continues and only worsens over time. And I think all of these things like create like we don't like to talk about it but like a level of impairment like in a physician who is excellent and knows her stuff and has trained many years for the work that she does. It becomes difficult when unaddressed and untreated. Like the research shows like the quality of care right that a really burned out physician provides is not at the same level as one who's not dealing with burnout, because there's like this little bit of a trivialization of like what burnout is, or maybe like a misunderstanding of how serious it is. Again, because it's not like necessarily a clinical diagnosis at this time. We push through it, right? Like the people that I see like in my practice often have been dealing with burnout on their own for years and years, like before seeking help, right? Because there's this idea that, I should be able to figure this out on my own, or it's not that bad. There's kind of a culture in medicine sometimes where like everybody is kind of miserable and burned out. And so it kind of feels like just part of the job. And there's a normalization of it instead of like seeing like, okay, this is a problem that should be addressed. There's stigma and shame too, right? Like, and so we push through it because we don't understand it until there's a wall that's hit, right? Like maybe it's a yeah, maybe it's a big mistake at work that costs, your livelihood or your reputation or shakes your confidence in your abilities as a physician. Maybe it's a diagnosis now of like major depressive disorder where that wasn't there before because this has gone on so long. Maybe it's like gotten so bad that you're forced now, as opposed to deciding to take some time away, forced like out of work. And with that, loss of income and, all of these things, like there's lots of money and financial costs to burnout that's unaddressed as well. And so I think burnout is a lot more serious, right, than sometimes we like to believe. And there's a lot of costs to the individual from a physical standpoint and a mental health standpoint, but also like a financial standpoint. And if we're talking like a big step back, like to our healthcare system, and we all rely on our healthcare system. Like we all want it to function and to work, right? Like I selfishly want to see a doctor, like whenever I go into to when I need healthcare or when a family member needs healthcare. And so there's a big ripple effect too that happens when burnout isn't addressed, and it's bigger than I think people think sometimes. So
Yeah, and I think it's way more pervasive too than people think a lot of
yeah.
times as well, because the expectations of high achieving women is that they continue to achieve, that they never rest, that rest is unsafe, and if they're not being productive, their worth is tied to that, all of those things. I mean, certainly I know men go through that too, but for the sake of this conversation, I think like the people that you and I work with the most, I think is I tend to see over and over again with my clients. Like, let's say I've worked with them for 3 or 4 years and they've recovered and they are, in that what you and I might use like words like flourishing or thriving or something like that for a certain period of time. But it does not mean that they're not going to experience burnout again. And so like what I find, certainly when I'm working with them one-on-one is we can recognize it a lot faster and we can start to maybe shift things around it. But the truth is, a lot of times their circumstances are such that they're feeling burnout at home. They might be caring for elderly parents as well as young kids. They might be, I mean, there are just so many things, like so many moving parts in their lives. And then you add the high pressure of just working as physicians or anything similar to that. And I think it's just a recipe for recurrent burnout. And
Mhm.
so, how do you help women on the other end of that? Yes, there are a few things that we can do, and I'd love for you to speak to that. Like, what is like the first three things that somebody should be thinking about if they're listening? They're like, "Oh my God, I'm in burnout." What are the first three things I should be thinking about? Small things, and then over time, what is just a general kind of idea that you want to leave us with? Like, hey, this is what I want you to be thinking about in order to prevent another episode of burnout.
Yeah, there's a couple questions in there. I think the first thing I just want to double tap on what you said is about like the recurrence sometimes of burnout, and kind of what you were describing sounded like, yeah, absolutely. Like sometimes the symptoms can lift, but the circumstances aren't that created it, that in part created it, aren't really changing, right? Like the toxic job is still there, the mile long list of responsibilities outside of work is still there, the ailing parents are still there, all of that kind of stuff. And I think an important bridge like between let's get you feeling better from a burnout, like let's recover from like the chronic stress state that you're in, and feel better and set you up and from an emotional and mental health standpoint to thrive, but let's connect that to action, right? That also creates change in some of those circumstances. It's not the circumstances in and of themselves, but like a person who I think a lot of times we stop too soon with the work that we do around burnout, right? It's not just about recovery or symptom reduction. And when you read like there's lots of research around burnout and studies that have been done around it, and usually the markers that are being looked at in those papers are like, here are the symptoms, here's what's being reduced. And I think that's important and a good start. Like you need to feel better in order to do better. But like I think what is missing a lot of times is like then taking that newfound like emotional well-being and turning that into like, yeah, actual change in your circumstances. Like what can I do like in my workplace to reduce my burnout? How can I set boundaries that protect me? What can I take off my plate at work and home? How can I say no without feeling guilty, right? Like what kind of changes can I really create in my external life so that my new life supports like this this more recovered version of me so that my burnout recovery actually does like have a chance to last, right? And so I can move beyond just trying to survive burnout and all of that into like a life that I really enjoy both inside and out. You asked like kind of what the first steps are, somebody who's listening identifies themselves in some part of this conversation, like, hey, I think I might be burned out. I think the first thing to hear is like, it's okay. There's a pattern, right? That we face as high achieving women. Like when we become aware of ourselves, right? Like, okay, I see myself in this conversation. I think I might be burned out. There's an immediate tendency for us to feel ashamed about that. It's almost reflexive, right? Awareness is important and no change happens without it, but the shame that comes with it can keep us stuck right in that same place. And so if you need to hear it from me and Dr. Rashmi, if you're experiencing burnout, if you see yourself in this conversation, it's okay. You have been functioning at an incredibly high level. And there's so many things that contribute to burnout, our biology, our psychology, the messages that we get from the world that tell us, as you said earlier, to put ourselves last, push through, work harder, intense pressure on high achieving women to these days be breadwinners and be the empathic listening ear and just be all things to all people. And so under the weight of all of that, anybody would experience burnout. You're not uniquely flawed or broken or anything like that, but it's okay. That's the first thing, giving yourself permission to have this and deal with this because you're a human being under an intense pressure. I think the second thing after kind of addressing that and aborting hopefully a little bit of that shame that comes with that awareness is apply the same compassionate, caring lens that I know you have for other people to yourself. So one thing we do all the time as women, whether you're a physician or not, is you're always checking on people. You're always asking them, how are you doing? Right? How are you feeling? How can I help you? We never pause to ask that of ourselves. And I want to invite you, take a breath and ask that of yourself, like, how am I doing? Right? Like, how am I feeling? Give words and language to, if you can, to your inner experience because it matters. You talked earlier, Rashmi, about like kind of at a certain point, like running through your life and it feeling like a dumpster fire and this, the never ending checklist that we're all kind of running through and not having a compass. And so we become humans that are just doing, 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 and we're operating on survival mode. We're operating on autopilot. We're not giving any attention to our inner lives, which is the exact recipe for staying in that place of until you can't anymore, like until you like literally your body like literally gives out. And so the way to kind of stop that cycle is very simple, like, and you're already good at it because you do this for everybody else. Ask that same question. How am I feeling? How am I doing? And answer that question honestly, and don't be afraid or ashamed of what comes up when you do. If you don't love what you hear, right? Like, okay, I'm not feeling great. Like I'm feeling really burned out. I'm stressed. I feel trapped. All of the things that might be coming up for you. I think the third thing is permission, right? Permission to reach out to lean on somebody else other than yourself, right? It's very hard, if not impossible, to really turn the burnout ship around by yourself, like, right, your brain is like under attack, like your whole body is like under like is flooded with like stress hormones, like, and has been probably for like a really long time. And so outside a listening ear, a safe space that's outside of you, and an outside perspective to help you kind of start to untangle some of the thoughts and the feelings and all of those things that are contributing to this is really important. But the bottom line is like you deserve to be heard too, right? Like I bet you listen to people all day long about their troubles and their struggles. I'm a psychiatrist. I definitely do. So and this was part of like, what I found and when I was experiencing this for myself is like, okay, well, sometimes I need to express myself as well. Where can you do that? And that may be with a therapist, it may be with a coach, it may be with a trusted friend. It doesn't really matter at the beginning. It's just like permission to share with someone like other than yourself and receive support as much as you give support. So I'd say those are the first three.
Anytime we kind of think of the most important things, they're always simple. Like there's nothing ever complicated. And the thing is, it's the simplest things that create the biggest shifts. And I see that over and over again, not just for me, but like with the clients that I work with. Like, and oftentimes they'll work through a huge like set of things that come up, and then when they look at their action steps, they'll go, "This is this seems simple. And I'm like, yeah, but that is what came through you, right? Nobody told you to do those things, but that's what came through you. And would it be okay if you just implemented it? And so sometimes we just have to give ourselves permission. And so much of that is that grace that you talk about, that self-compassion, self-awareness, self-acceptance. Holy smokes, those are big ones. Those are big pillars that we were kind of conditioned to not do. And so and yet it is our innate nature to be of a service to ourselves, but we just forget about it because we think it harms someone else. And so I think it's like so important to create enough safety within our own mind body system to then co-regulate with somebody else and then say, hey, like this is what I'm going through. And like just speaking out loud, especially what you mentioned shame in one of the times that you were talking about. I mean, I think it said that shame can't survive being spoken of. Like the minute that we start to speak about it, then the isolation part goes away and that cycle can start to shift. And so it's really very powerful what you mentioned. And I think if somebody's listening, we're like, yeah, of course I can do that. But just do it. Just do the things and see, right? Like, and reaching out to somebody, I think that can be such a huge sort of like relief when somebody can just hold safe space for you. There is no substitute for that. Even in the small group sessions that I do sometimes, people will say, I don't have any other place like this in my whole entire life. And I work in so many different areas. And so creating that safe space is such an important thing. That's the work that you're doing with these women who really are thriving and not just surviving anymore.
Yeah.
So we're coming to the close of our time together, Jeannie. People are going to want to find you. And so I'm going to have your website and all the ways in which people can find you. And so, dear listener, look at the show notes. That's all going to be in there. Jeannie, one of the last questions that I like to ask is this idea of lightness of being as a practice. And I find it to be fascinating how people either consciously or subconsciously may be practicing these. How do you bring lightness into your life?
Yeah, I have many practices, but I'll share like my top couple. It's evidence-based and it works, and it's gratitude, and it's a practice, right? It's something I do personally, and I encourage my clients to do it as well. And I find that in the beginning, like if you're not in the habit of kind of like scanning your environment for gratitude, what you have to be grateful for, it can feel kind of hard. And by the way, I call it gratitude and gains because there's a little bit of a difference between like scanning your environment for what you're grateful for, but also scanning your environment for how you're making progress. And this really speaks to like the high achieving woman who wants to feel like a large part of her self-esteem and worth, is kind of caught up in this idea that she is making progress forward. And I don't think there's anything wrong with that in and of itself, that we can talk more about, tying our worth to our productivity and things like that. But like when you are goal oriented and when you are high achieving, like you want to continue to be that way, and that's okay. But like when you're in the throes of like trying to move your life to the next level, and this is really talking more about moving beyond just like the emotional part of burnout into like the thriving and like actually changing your life. Like it's scanning your environment for what you're grateful for, but also how you're gaining. Our human brain loves to think about like how much further we have to go and then feel like a failure when we notice that the goal that we've set before us is further away than we ever imagined. And so the thing that I like to do daily, and I do it at night, by the way, I'll tell you why in a minute, is to recognize that regardless of how much further I have to go, I've come so far. That turns gratitude inward, right? Like gratitude outward is like I'm grateful for this gorgeous day. I'm grateful for my friend Rashmi. These are wonderful things to be grateful for, but also like how am I moving forward? Like what's really working? How are my efforts actually pushing me forward? What can I be proud of? Like, and there's a different flavor there. And so gratitude and gains. I love to do this at night, by the way. I know lots of people do their gratitude practice in the morning, and sometimes I do that too. But a high achieving woman in perimenopause or menopause probably struggles with sleep, and a lot of that can come from kind of all the unprocessed questions and emotions and things that have come about the day. But I think a beautiful punctuation to the end of a day is taking some time to write down what you're grateful for and the gains that you've made. And I do it every night, and I honestly sleep so well after I do that. It's like kind of like making sense of like the past 24 hours and recognizing that it wasn't just another day and it wasn't a wash of a day just because I didn't have like some obvious win, right? But like taking inventory. And once I do that, like, and this happens for my clients too, right before bed, it's like, oh my gosh, this day was a-okay, and I can sleep really well. That's one practice that I have. I think another, I'm calling it like kind of chasing aliveness. So it's like, as high achieving women and women physicians, we can be very cerebral. Like our work is very cerebral. We think a lot depending on your setting, like where you work. Like I'm an entrepreneur, like I work by myself a lot of the time. So there's like a lot happening like in my head all day, right? And we can become really good at thinking and a lot kind of detached from like feeling our emotions and feeling like remembering what it is to have fun and to feel like actually alive, like in our body and our lives. My practice is around, I call it chasing aliveness, but like noticing, it's essentially kind of noticing, like as I go through my life, like what things energized me, like as I go through my day, what things made me feel like myself, what things put me into a flow state, and then doing more of those things so that my whole life doesn't become your whole life doesn't become just like one big thought exercise, right? Like, but like you start to feel engaged in your life again. And I think that's a really important practice and brings a lot of joy, vitality, energy. And I can't imagine not doing it. So just something to offer.
Beautiful, absolutely beautiful, and really relevant to our time too. And so, thank you so much for sharing your wisdom, Jeannie. Thank you so much for sharing your story. And I am just so grateful that we reconnected, and I'm grateful that you're doing the work that you do. And you can find Dr. Jeannie, like I said, on in the links in the show notes. So pop in there. And then, if for some unknown reason you are listening and you have not left a review yet, please just run. Do not walk. Run to the review section and just leave a quick review. And I can't wait to see you on the next episode of Inner Peace and Power.